Hi, my name is Claudine Lewis. I'm a respiratory therapy student at Southeast Community College in Lincoln, Nebraska. I'm here to go over some oxygen devices and oxygen tank safety here real quick. So first of all, I have an E-cylinder. This is a grab and go type, which you cannot see. Grab and go. I know it's oxygen because it's green and it says that it's oxygen. This is a sealed cylinder, so I would have to take off the plastic cap here. And that's the large diameter safety system, the DISS. And then over here we have the smaller one, the American Standard Safety System. So I'd have to thread on a Christmas tree to that to be able to deliver any kind of oxygen. Oxygen is combustible. It doesn't really start a fire, but it will certainly feed one. It's got all of its DOT markings on here, date of manufacturer, and all of that good stuff. So my Christmas tree grows right on there, just like that. And so this is grab and go. There's no need to bleed and crack the cylinder. It's got a built-in nipple there. And to know how long this would last me, I would look at it, and it's on green. It's showing right at 2,000. So it's an E-cylinder. So we would take the tank factor, which is 0.28 times 2. Well, I would subtract 500 for the safety. You don't want to get that last 500 out. There can be dirt and debris in it. And that would, let's say I was going to use a nasal cannula at 4 liters a minute. And that would give me not quite 2 hours, like 1 hour and 45 minutes, 1.75 hours of time. So here's a nasal cannula. This is getting anywhere from 0.25 liters or a quarter of a liter up to 6 liters. And let me double check that. I think it's 8. Yep, it's 6. I was right. So it's got little hooks on here. You want this inside your patient's nose, facing this way. Going this way, it'll just hit the nares. So we would plug it in here. Turn it up to 4. I can hear it. And this would go over the patient's ears. This is really wadded up. And there we go. Like so. You tighten that up until it's comfortable for them. You don't want to squeeze them to death. Make sure they don't use any petroleum products, especially Vaseline. Vaseline is highly flammable. It will spark with oxygen. Some other safety is definitely want to make sure it's oxygen. Don't want to have it out loose, so that's why it's in this cart. We'll come back to that in just a second. So we have the nasal cannula. We have a simple mask that does not have a bag on it for a reservoir. The minimum flow on this is 5. Most people go from 5 to 8 on this. And it goes over the patient's head. It does not have little plastic things to prevent exhale. So when you exhale, it goes straight out. Nice and tight. It's usually over the ears. And this one will go at least 5. That's also all wadded up. They pack this nicely. And if any of this touches the floor, it's dirty and can't be used on a patient. So let's say I was going to use this same tank at 2,000. Let's say I would do it at 10 liters a minute. Subtract the 500, you get 1,500. This would give me about 52 minutes at 10 liters a minute with a simple face mask. I would want to make sure that it's on. I can hear it. Fantastic. Here we have an on-road breather. And this has valves on it. There's a valve there, and there's one on here, so there's one for exhale. So it kind of mixes a little bit of room air in, hardly any. And also I'll wadded up. And I'm going to plug that in. And we want this one on at least 10. Most people go 10 to 15. Bag should inflate. It's not wanting to. So I'm going to cheat. Put my finger over that little valve. Okay, 2 fingers over the valve. And get that to inflate. Because if it's not inflated, it kind of acts like a paper bag. You just keep rebreathing CO2. And it goes like that. And you tighten it up a little bit right here for patient comfort. Put it on the nose. Super handy because it's useful for adults, pediatrics, and infants. It comes in all sizes. So does the simple mask and the cannula. Here I have my Snazzy Venturi. This one is good for high flow. It's good for your COPD patients. It helps you regulate their FiO2 much easier. Get that on there. And it's got a dial on here, which says roughly about how much percentage you're giving. So we'll say, I can't get it to turn. Fantastic. So 40%. So the little air intake has gone down a little bit. Here's a way to add humidification. You would have the larger tubing, such as this, and hook it here, and then you can add humidification to it. I can hear it, so I know it's on. It's really deformed. So also goes over the patient's heart. With that device, you want to make sure that you're meeting your patient's flow. So we want to ensure that we are meeting their minute ventilation demands. And there's a snazzy equation for that. Which I lost. So let's say they're at 40%. Well, room air is 21%. So 100% minus 40 over 40 minus 21, 60, 19. So I get a ratio of, I'll call it 3 to 1.